Everyone, I take this opportunity to introduce Dr. Santosh. He is a very close friend of mine. He has done his MD from uh, Institute of Medical Sciences, Banaras Hindu University, and he is currently working as additional professor, Department of Community Medicine, Community and Family Medicine, AIIMS Rishikesh. He has a vast experience of working in rural areas. In fact, uh, every person in AIIMS Rishikesh knows that how true community person Dr. Santosh is, because he believes that the true service can only be done in by going in the community. So we have a privilege of inviting him, and we are honored to have him here with us. And we request him to share his experiences working in the rural areas and how by doing small things we can make a greater change as he has done in the state of Uttarakhand. So I request Dr. Santosh to share his experiences. Thank
Uh,
you.
Dr. Pradeep, my slides are visible.
Yes, sir.
Am I visible?
Yes. You are
Okay,
audible also.
okay, great.
तो संतोष बस वो जो वहाँ हाइड वाला एक नीचे आ रहा है बटन
हाँ,
स्टॉप उसको
तो
जस्ट
हाइट
प्रेस
में
कर
क्लिक
दीजिए
कर दीजिए। हाँ।
दैट्स
जी,
दैट्स सो
it's all right, sir.
या नेक्स्ट परफेक्ट
Okay. So, well, a great and golden morning to everyone. Respected Dean Academics, Professor Kuldeep sir, he has been a great inspiration for me since beginning, and he has a mantra for me. His contribution in the primary healthcare is really remarkable. Thank you very much, sir, for giving me this platform to share my experience. Dr. Pradeep Dwivedi, he has been my friend, mentor, as a great motivator for me. He used to say that we have to think out of box, and his this contribution to the country and in the primary care is really out of box thinking. And I'm really proud of you, Dr. Pradeep. So, dear students, I'm just sharing my experience and what I think that you please feel it, and after that you think and start working. You know, if you, I have been asked to say something about the tribal of Uttarakhand and how the tribal of Uttarakhand would be different from the tribal of Rajasthan, Jodhpur. So it is like that. How I am different from you? I have been born and brought up in Uttarakhand, and how my colleagues are different from me. You can say that I might be having a different food habit, you might be having a different food habit, and my thinking pattern might be different culturally and socially, and you may be different. So what do you think? Do we really need to discuss that how characteristically they are different from that, and it is enough? What do you think? This is my clear cut message for the youth. So let's think. Let's take me you all through a different journey. This is my short introduction. I'm working in a field, and this is the different area of Uttarakhand, and the social outreach cell through which, under the supervision and guidance of my honorable director, Professor Minu Singh, and head of the department, we are trying to step out in the community. So before I proceed, I just would like to invite all of you in a beautiful place in Dehradun. It's a Dehradun, beautiful building. It's a night of Masuri. So I welcome you over there. And there's a beautiful place in Dehradun. These are dense places. And this one is the Masuri. Right? So how we see the world, it looks like that. It's very attracting from outside. But what is real? This is the real picture. When we transect that community, it's a Dehradun. It's a real picture of Dehradun, where when we have started transecting the community, this one, but it is not appears. It is not appearing anywhere. And no one would like to discuss about that. Right? If we start discussing about that, maybe our attraction will be fed up. Now, what happens? What is the biggest thought process, when you start thinking about the public health or primary care, it is something, when as the name sounds, that something fascinating. uh, it must be WHO and something beautiful. And the biggest mistake happens over here when you start seeing that, and it is very fascinating. But if we start seeing the real picture will come through this. That's all. And this real picture is sometimes it's very, very difficult to bear. That's why we don't want to say it. It's all right. So when you see the patient at the tertiary care, what is the picture? When you see the patient at tertiary care, this is only a part, a fragment of this apple we are able to see at our tertiary care setup or wherever. We are not able to see the entire apple. Or what do you think? If you are treating this as segment, are you able to treat the entire apple or not? You don't know what is the problem at the back of this apple. You don't know, right? And you make it good, and you treat this one, and you think that you have treated entire apple. It's all right. In the same way, we are treating, when a patient is coming to us in a tertiary care, we are treating some of the segment, some of the dimension of that. That is, suppose they're coming to us with a pain, and we are treating pain with giving some antibiotics or some NSAID, and we think the pain is resolved. No. The person who is coming to us with a pain, a pathology, a problem that is surrounded by his biological, social, psychological health. Are we touching the different dimensions? Are we touching the different area of health which is responsible for his pathology? In the same what I have said initially. The apple in the Rajasthan will be the apple of the Uttarakhand, and apple of the Kashmir will seem same. The appearance will be same. Maybe little different taste. Do we really need to discuss it, or do we really need to explore it? Do we really need to transect it? Do we need to study? If there will be a difference among the people, that we have to understand these all dimensions. And I congratulate the Dean Academics, Professor Kuldeep sir and Dr. Pradeep Dwivedi, that they have allowed you all to explore these all finding. Ladies and gentlemen, until we explore these all dimensions, the health will always be incomplete. We cannot do anything. We cannot treat the pain. We cannot treat the last stage of disease. We have to understand from which background, from which area, what are the different factors which are responsible for that disease. Then we can say about, then we can think about primary care. Is all right? I'm understood. What is the second line? Whenever I'm going to the community, when I'm discussing with the community, they are having a different demand, and we are having a different supply. You can see this picture. If somebody is demanding this one, burger, pizza, and we are supplying this one, and we are convincing them, come on, ladies and gentlemen, this one is very nutritious. This one is very, as we are doing in our tertiary care, we are doing in our clinics. So you have to eat this one. You have to take this capsule. You are not supposed to take this salt, and you are not supposed to take this sugar and this blah blah blah. We are throwing lots of information. Have we ever thought what they are demanding? This gap between the supply and demands leads to the public health crisis today. Public health crisis today is just go ask. Until we don't, suppose I am going to a slum and distributing them a laptop. Do they really need laptop? But what I'm doing, I'm being very much obliged. I'm being very much having a greatness for them. I'm expressing my greatness. Then I have given a laptop of 60,000 and 70,000 among them. Do they need it? So why I'm giving this example? This example is for the leader of country. This example is for the public health specialist of the country, are they making a program? Are they thinking about the demand of the public? And the demand of the public, if I have to understand your demand, then I have to come with you. I have to mingle with you. I have to understand you and what you are trying to do. It's all right. I think you must be getting what I mean to say, ladies and gentlemen, and my students. It's a great opportunity. If you want to be a great doctor in future, if you want to really transform the medical health, where you are right now in a tribal area, in tribal, if suppose we remove this tribal word, this is a community. This is a community we need to understand, right? They are not different. Why they are different? Tell me, if there is any dengue outbreak in the tribal population, it will not come to the general people. Why we are not taking care of the people who are at the periphery? Why we are only focused with a fistful of people who are coming to us? Now you can understand very well what I'm talking about. This is the health, this is the pyramid of the healthcare delivery system. And this one is the broader and largest part of this pyramid. It is untouched. Preventive services, what I'm talking about, right? If you want the food habit or habits of the people need to be changed, the habit cannot be changed in a single day. Cultural influence and atmospheric influence and environmental influence cannot be changed in a single day. It will take a time. In the similar way, diabetes doesn't happen in a single day. Atherosclerosis doesn't happen in a single day. Kidney failure doesn't happen in a single day. It's have a long process, a continuous process, a pathogenesis. And if you want to make the people healthy, community healthy, that we have to work over at this the broader base. But what we are working over this here, maybe a little bit in the secondary healthcare and the tertiary healthcare. And you can know, my dear students, I think you must be understanding, you must feeling something. What I mean to say that what the portion of the people, what we are dealing with, either they are diseased and sometimes they are diagnosed, right? Even we are taking time. So this is the cone that is called the iceberg phenomenon. We are treating an iceberg. I treating an iceberg of this pyramid, and when we are treating, some of them are controlled, some of them are not controlled, because we are saying that we are giving a list of things to the people that you are not supposed to do this, you are not supposed to do this. We are trying to change the hardcore habits of the person who is coming to us, because the person is having a long back history, culture, social influence. He or she may or may not change it. But we are trying to control it. That's why I'm saying some of them will be controlled, some of them will not be controlled. Yes, definitely. We are treating them. So iceberg phenomena, I have given a sort of terminology in the public health. Yeah, this one is, I have given this slide to the antibiotic resistance, but that is the submerged phenomena. You know, now the treating physician is also diseased. Sorry for this word. This is antibiotic resistance. I have used this slide anywhere. But what I mean to say, the submerged phenomena means today is the time. Once upon a time, it used to be a iceberg phenomena. Right now, it is submerged phenomena. जो ठीक कर रहा है वो भी बीमार है, जिसको ठीक करना है वो भी बीमार है, सब लोग एक जगह पर डूबे हुए हैं हम लोग. Now, this is called a public health crisis. This is already a public health pandemic we are facing in the non-communicable diseases. Non-communicable disease, every third and fourth person is having diabetes. So are we treating the iceberg? Still I think it's a Matter of question, we think that we are even not able to treat completely the iceberg. So what we all people are doing, and what the exposure has been given to you by this outreach program, I would rather say this is a wonderful outreach program by AIIMS Jodhpur. I really, yesterday I was discussing with the Dr. Pradeep out and sir also that uh, we are we are doing the outreach program, but would like to replicate your model and the Uttarakhand also, because it is much needed over here. And what we have to do, that what is the advanced triangle? Advanced triangle epidemiology means if we have to see, think, study, that we have to go through the epidemiology about any of the disease, even for the communicable disease, for the non-communicable disease. Environment, yes, definitely, because the effect of the environment is there. That's all right. And tribal population of Uttarakhand, they are having a set of beverages. And what is the notion for that? You know, ठंड अगर हो जाती है तो this beverages work. It works. These are healthy beverages. As a medical people, as a medical science person, how it can be healthy, we have to discuss it. We have to think it. There are lots of notion and lots of concept among the people that uh, this beverage, which is homemade, some of them they are fermenting in, some of them they are not fermenting in. There are different preparation of beverage, alcoholic beverages. We are everyone, even in a in very cold area, they are giving this beverages to even their child, right? And they are, what is their notion, what is their thinking? It is very helpful to suppress the cold. Is it now we have to study this. We have to study this. All right. We have been with I mean we have been in Australia and mental health leader some workshop with Kuldeep sir. Then we have discussed on that the people, even in the hilly area, that they are using the beverages in the name of that it is subsiding the cold and it is beneficial for health. So that is the area where we have to study. Then we can say that we have to explore. Even say about the substance abuse or substance use, they are exposing that small amount of beverages to the child since beginning. And if it will be continually used among them, once a time will come when it will be, it will increase. I mean, what we say, that the amount of alcohol which is being served to a child at the level of understanding that it is a therapeutic level, after some time the amount will be increased, and you know that the tolerance will also increase. That amount will might not be affected for that particular illness or for particular things, but they are expecting to be helpful for that. So again, what we are doing, that the group of people are becoming addicted for that particular substance. So that environment, behavior, physiological and ecological factor, that has to be studied, and what you people are doing over there, and the group and characteristic of the population need to be understood. And then the cause, the causative factor, what are the different causes for that? If you understand, if you are understand this all triangle and these all factors in a community, in society, then we'll able to know that what are the factors responsible for the disease, what are the socio-cultural factors, what are the populational, what are the characteristics which are responsible for the particular disease and illnesses. And this is a wonderful idea of creating an outreach program like that the tribal health, what has been established by the AIIMS Jodhpur. It's a wonderful opportunity for the resident. Even this is a new chapter you have added in the life of undergraduate and postgraduate, because during our medical profession we have never been taught about that. We are completely disease focused. We are reading pathology, we are treating pathology, we are just putting the medicine, and we are continuously treating that the iceberg of disease we have never been explored. And when we come outside, the people from that community are coming to us, and we are not able to succeed. We're not able to succeed that what we are, what we have to, what we are expected to. That's why the different domain of people are coming over us. They are teaching us, they are preaching us. Is that right? Because the segment what we have left is taken care by the people, even they are the non-medical people. Is that right? So by doing this, we can create the information education, communication, behavior change communication, and socio-behavioral change communication. Because ultimately, if we want to change the risk factor can be changed since beginning while exploring the environment, physiology, ecology, and the population characteristics. And socio-behavioral change communication will lead to people live a healthy life and sound life. What is the dream of the medical science, and what is the dream of any doctors? Now I come to that. You will say, yeah, I have why I am coming to these all in last or in middle, because now you can say what we need to study, what we need to understand. These all statistics? No. What do you think? Only by reading the statistics, by knowing that he is bad, he is good, and they are different? No. We have to understand them, why they are following that. And for that, we have to understand their culture. We cannot say that you are wrong. We cannot say that the beverages when they are using, this is gone. We cannot say your culture is not good. There will be a huge process on outside. There will be a we cannot say, even we cannot comment on their cultural habits. No, we have to go, we have to understand, then gradually they, and make people that they will understand us. I have created one model, that the rapport building in the community. You can recently published in Scopus journal, that rapport building in the community, how to make a rapport building. If you are saying we are saying, oh, this is wrong, and this why you are taking this alcohol and beverages is harmful for the liver, there will be a great revolt. No. And maybe some of the people are doing like that. That's where the public health in the community and primary care is neglected. Ladies and gentlemen, primary care is very much neglected, and we are not able to overcome with the diseases till now. You know, as the number of AIIMS, number of hospitals are increasing, the diseases are increasing in a similar proportion. Why it is happening? Because only the iceberg is being treated, and we don't know that everyone is submerged over there. So ladies and gentlemen, we have only 0.3% of the total tribal population in India. Just for the glimpse, we have Bhotia, Jaunsari, Raji, Tharu, and Buksaj. And frankly speaking, I am doing the work in the outreach, but I have never been among them. They are interacting in outreach. I am meeting the segment of the people, I am meeting with them, but I am in the process of targeting. I am in the process of mingling with this group. Just, you know, the 94% of tribal population in the district Udham Singh Nagar, recently the new campus of AIIMS, which is going to be established over there. And for your kind information, I am the nodal person for that, for the outreach program. And Udham Singh Nagar, our Chief Minister, Professor Mr. Dhami, Pushkar Singh Dhami, he belongs to this Udham Singh Nagar, Nainital, and Dehradun. Whenever you are coming to this place, then you will visit a different market over there. That market belongs to this tribal people. And Jaunsari is the largest tribal, followed by Tharu with the second largest. In Uttarakhand, constitute 32.50 of total tribal population. The total population of Tharas is spread over the 141 villages of the Sitarganj and Khatima development block newly formed in Udham Singh Nagar of district Uttarakhand. Right now, this is the literature what saying, but if we see the real picture, still they have started migrating. The migration is there. Very few population, very few people are there in the interior area of the Uttarakhand, especially in the hilly area. In Udham Singh Nagar or Nainital, very few segments are there. They are working in a group, but most of them have been migrated to good cities in Delhi and this all area. But still they are with their different culture, dressing sense, and their upbringing. The tribal population of Uttarakhand are known. Yes, we have what we call the tribal Mela in Dehradun once in a year, which is usually inaugurated by Chief Minister. And all the folk dance, all the cultures are being played over there. And if you'll go in Kedarnath or Badrinath, you will see the people are still following their old tradition, own culture. So the Jaunsari tribe is the largest tribe, and they are in Uttarkasi, Jaunsar Bhabar, right? And they are having their dressing, and still they are following the same culture, same dress. What you are able to see in the pictures, they are very hardcore. Uh, they are very much traditional, hardcore traditional for their habits, their dressing sense, their culture. And Tharu tribes is the second largest tribe, and they are having some um, I mean joint families still, and they have been told and considered that their ancestors are the native of the Tibet, and they have been migrated from that place. And the Tharu culture is their community has a matriarchal nature, and the female dominance uh, is there, and there is strong tradition panchayat organization to settle their dispute on the basis of common code of conduct. But it is not very much hardcore right now. They traditionally they are very sound, their dressing sense, but as far as that the organization is concerned, now they are following the rules of the government of Uttarakhand, and the legal issues are there, but some of the pockets they are still believe that what they have been and what they have been following their own culture since beginning. So the Buksa and Bhotia tribes of Uttarakhand, then the 173 villages in Nainital and Dehradun districts, but we have to go and we have to search them. And some of the villages we have visited, but they are not right now because of the advancement in the medical care and advancement in the recent influence of the recent traditions and culture. Uh, they are on and off. They are celebrating their own culture, but still some of the pockets are in Pithoragarh, in Mana. I mean, near Badrinath, and in valley of Kedarnath, you will get those people. Buksa and Bhotia, you will get it. And Nainital and Dehradun. Nainital means it is Nainital means not Nainital. Nainital means Nainital district. The Nainital district is very wide. It is then we'll go to the interior of the Nainital area. Then we'll get some of the pockets of this the tribal population, and Almora, Chamoli, Pithoragarh, Uttarkasi district of the state. This Bhotia, you can get that they are very much expert in weaving of woolen yarns and woolen goods, such as Dr. Pradeep Devdi might have visited to that area, and whenever we are going, they are making it. They are very, because that's a sub Himalaya region, that hilly area, Himalayan region in Garhwal, Chamoli Garhwal, and near the Badrinath. So they are having the I mean, good making of the woolens goods such as carpet, blankets, and sweaters. The traditional garments has been the specialty of the Bhotias, and they are having the similar dress. You will say, you can see that the Badrinath Mandir over there, and you'll find whenever you are coming, you can meet them. And this is the Raji tribes, and it's very less. And in the forest of Ashoka in the southern Pithoragarh, if you go to the Pithoragarh, when we get it, and lots of the medical studies has been very less, but the historical research have been done in the tribal of Uttarakhand. So medical research is very less over them, and that's why we are trying to explore them we are trying to explore them, but those people are located in very hard to reach area, very difficult area. Now we have a drone and we have a mobile van over here, so we are planning to explore this area very shortly. But only exploring, only seeing, and only getting the data will not be our aim as well. And this is something our achievement. This is all about the tribals population of Uttarakhand, but only that the picture of the tribal population is not sufficient, but we are intended to go among them and how to explore them and how to transform the changes, how to bring the changes at their conscious level or subconscious level, by which they are surrounded with lots of disease because of their habits, their culture. And this is the achievement what we have seen in the AIIMS like institute. In some people, some that we are catering the services of the interior part of Uttarakhand also through the family medicine OPD. Some of the tribal population are also coming to us, and because it's very easy to counsel 1% and 2% in my OPD by giving the sufficient time, and it will take up a long time to make them convince कि नहीं ये चीज सही है, ये चीज गलत है. बहुत ज्यादा time लगता है. We cannot directly say that it is wrong and it is right. So ultimately, when they got benefited, they want to give something to us in a writing that they are feeling, they are explaining over here. So this is why what I think, if you are working in the community, if the community is coming to you with this way, it's sometimes it gives a feeling of pride, and this is a primary care practice. We have developed a Facebook page also, and this is something, the outreach camp we are going in the different area of the community, where we are trying to discuss with the people and trying to understand the people. And when what we found when we are addressing the people, and we are giving a huge benefit to them. And we have a 2 urban health center in the slums. We are catering more than 1 lakh people in the slum area through this health and wellness center. And this model what we have created, I am just showing these all because I am trying to understand that what is the need, what in my previous 4 and 5 slides that I have I'm trying to convey with you, that I have felt in myself that how to address this all. So I'm making this the sort model over then how to address the community need. How to address the community need? If you have to understand the diabetes, then we cardiovascular disease, so we have to go what they are demanding. As per their demand, we have to supply, and we have to make them understand. And this is the home-based mobilization program we have developed over there, that how we'll assess their need, how we'll make a epidemiological spot mapping and health awareness, and what will be the impact analysis that we are trying. The community wellness program, the physical health, mental health, the social well-being, and spiritual well-being. And students, you must be from the different background. Either you are surgeon, cardiologist, and whatever. But you have to understand this all, because if the person with the surgery, if coming to us, they are having their own concern. They are having their own culture. Social concern. So if you have to convince him or her, if you want a good surgery to be done, then you have to address this. Or it's a wonderful opportunity you people have while you are in the tribal center over there. Please go around and talk to the people. This is a wonderful period of your life, and you should be thankful to the dean academics and the administrator and director of the AIIMS Jodhpur. They are very they are encouraging you, and I'm very surprised that a person from the pediatrician and a person from the pharmacology are turning towards a public health and a primary care. Uh, Rest of the public health people of the country should learn, and I'm learning. Frankly, I'm learning. And this is the home-based primary care. This lady might be having a different notion that the AIIMS is different thing, the doctors kuch aur hote hain. There are different notion, different concept of the people who are in their home. When you talk to them, when you meet them, you are able to throw the light of the wisdom. You are able to make them aware. So different experience over there. And there in the slum area were also working at the doorstep. So within 1 and 2 minutes, I'll cover because I'm just showing what we have done. The 7+ program on the basis of that. We are treating in the dengue in a hospital. I thought let's treat it in a community, and we have developed a 7+1 program. While interacting with the ASA, it's a multidisciplinary program which is run by the community, run by the people. This is by the people, by the community, for the community, and by the community members. This program, 7+ program of dengue prevention, it was right now. We need a leadership in the community. We need a leadership. Doctors need a leadership at the primary care. Wherever you are, we need a leadership. So that this program has been adopted by government of Uttarakhand. And from the Director General of Health Services of Uttarakhand, it's adopted it and circulated to all the people. And right now we have adopted 18 villages in the interior area, including that the tribal population are also coming inside that the integrated health service model. And the stuff wise, what we have gone through the phase 1, phase 2, phase 3, phase 4, and finally what we do that. What was the impact? And very soon you'll be happy to get my book on this integrated community health service model. We have implemented this model in the 18 villages, 2 to 300 kilometers far from this, where even the health services are very poor and in the hilly areas. So doorstep primary healthcare model. Recently, we are on that. Through the mobile van, we have at the mobile van, we are taking doorstep. It is not that like that we are making people handicapped. No, we are making people more convinced about what health is, right? This is the way. Let them understand. उनको पता तो चले मुझे चाहिए क्या, उनको पता ही नहीं है मुझे चाहिए क्या. उनको लगता है कि मेरा सर दर्द हो गया तो न्यूरोलॉजिस्ट को दिखा दो. ये गलत बात है, ऐसा नहीं है. सर दर्द के बहुत सारे कारण हैं, ये भी उनको पता होना चाहिए. ये भी पता होना चाहिए कि कुछ एरिया और भी हैं, कुछ डॉक्टर्स और भी हैं जो कि प्राइमरी केयर जिसे कहते हैं, ये भी उनको पता होना चाहिए. दैट्स व्हाई वी आर मेकिंग देम रियलाइज. एंड it's a unique experience when you talk to them. I request, after this session, I request all the residents, please interact with the people and interview them about their health. What do they understand about health? What do they understand about surgery? What do they understand about the medical science? आप बात कीजिए उनसे, आपको एक कुछ नया अनुभव मिलेगा. In the last slide, I am going to conduct a conference, national conference in the public primary care and family medicine in September 27 to 29. Now this is the real picture of Rishikesh. You are most welcome, and thank you very much, sir, and Dr. Pradeep, and Dean Academics, Professor Kuldeep, sir, for giving me this opportunity to interact with your student. Thank you very much, sir. You're most welcome.